We're going to wait another minute, just give some other participants a chance to join us, and then we'll get started. So welcome again to everybody who's joining us for this afternoon's webinar on developing quality assurance plans. We're going to go ahead and get started. I'm sure other folks will be joining us along the way, so we might repeat our introduction a little. But thank you so much for joining us this afternoon or this morning for those of you joining us from Hawaii and the Pacific Islands. We're really excited about today's webinar on quality assurance plans. It's a topic that we get a lot of requests for support and information around. And we have a great webinar to share with you. So my name is Sonia Dublin. I'm a Capacity Building Assistance Specialist from Capacity for Health, and we are hosting today's webinar. We are a capacity building assistance provider at the Asian Pacific Islander American Health Forum. We have offices in San Francisco and DC, and we are in the San Francisco office today, the Capacity for Health staff, and our presenter, Melissa Werner, is going to be joining us from Washington, DC. So we're actually funded by the CDC, the Center for Disease Control, to provide all kinds of support and free capacity building services to organizations, primarily ones directly funded by the CDC or funded by their local health departments to do HIV prevention work. And we do really wraparound services, everything from organizational development and things like fund development and board development to work on the specific evidence-based interventions and public health strategies that the CDC is currently funding. We also do a lot of work in the area of monitoring and evaluation, and today's webinar on quality assurance falls into our monitoring and evaluation area. So just a few housekeeping announcements before we start the content of our webinar. Everybody is actually automatically muted by the webinar administrators. If you're listening in on today's audio through your telephone, please make sure to enter your audio PIN. Otherwise, we're not able to unmute you for discussion portions of the webinar. If you have questions or comments or things you want to share with us, you can chat them in the chat feature in the bottom right-hand corner of your screen. Or you can also raise your hand, the hand icon. You click on that, and we can actually call on you and unmute you if you've entered your audio PIN, and then you can actually ask your question live. We'll have opportunity for Q&A and probably some discussion throughout the webinar, so feel free to share your questions and comments in either of those ways. And if anyone's watching the webinar with multiple colleagues around one computer screen, please just chat in your contact information so that we can include you on any follow-up. We do follow up after all of our webinars to get your feedback, as well as to share with you the webinar slides and or recording and or resources that we talk about during the course of the webinar. On a final note, today's webinar will be recorded. The audio recording will be made available on our website, and we will give you the information at the end of the webinar about how to access that. So without further ado, I'd like to introduce our presenter today. Melissa Werner is an accomplished belly dancer, knitter, and scuba diver, among other things. She's also the mother of twins, twin 3-year-olds. But what we are really excited about having her share with us today is her experience in quality assurance and in program management. She has an MPH as well as a master's in teaching, and we first started working with Melissa around developing curriculum, health education curriculum and training materials. And she has a lot of experience working with a wide variety of organizations, national and local organizations in HIV prevention as well as other fields. And she's done a lot of work in the field of quality assurance. So we are very excited to have her with us presenting today. And I'm actually going to go ahead and turn over the controls to her so she can share with you the content of our presentation. So welcome, Melissa.
Hi. As Sonia said, my name is Melissa Werner, and I'm happy to be here with you today to talk about developing quality assurance plans. Why are we here? Well, the goal of this webinar is to hopefully enhance your knowledge and skills related to quality assurance, or what we'll call QA, just because it's a lot easier to say than quality assurance. And this is all in order to assist you in either developing a QA plan if your organization doesn't have one, or in enhancing or improving an existing plan if you do have one. More specifically, our objectives are that we hope by the end of our hour together that you will be able to define quality assurance and explain its importance. And I noticed from the information that many of you sent in as you registered, this is not a new field to many of you, so you can some of you can probably do this already very easily. We'll describe how a QA plan fits into an overall quality assurance program. So what's the relationship between the plan and any other strategies and programs that you may have at work already. We hope you'll be able to identify the major elements or parts of a comprehensive QA plan, that if someone were to ask you, that you would say you feel confident in developing a QA plan, and that you'll be able to identify at least one strategy to implement in your organization. In other words, this won't all be background. You'll come away with something you feel like you can take back to your agency and put into work. In terms of what we will be covering today, we'll have three main sections. The first will be a brief overview of QA as it relates to the development of an organizational QA plan. Then we will talk about the elements, or basically sections or parts of a QA plan. And then finally, we will direct you to some additional resources related to QA and QA plans. That's something Sonia mentioned already. We don't want to leave you hanging. We want you to have additional resources that you can turn to once we're done talking today. I'll also let you know that we'll have a couple of short polls and some other opportunities for participation throughout the webinar. I am hoping that we'll be able to use the chat feature for all of you to share some examples from your own organizations, and the reason for that is threefold. One is to keep everybody engaged and awake, because I know how easy it is to find other important things to do while you're at work, and I know you're all very busy, so hopefully this will keep us moving, keep everybody's attention. Certainly I want to give people an opportunity to take the material we're discussing and apply it in your own work setting, so it becomes more real, and say, hey, yeah, this actually does apply to what we're doing, and here's an example. And then third is because I find that in any kind of training, whether live or over a computer and or phone, that people learn best from each other and from people in similar work settings. So I think hopefully we'll be able to take a lot of ideas away from each other over the course of the webinar. Also, we'll be using a case study in the section that discusses all of the elements of a QA plan. And so we'll have a fictional organization that we hope will sound like it could be real, and we'll look at what they included in their fictional, but again, hopefully realistic plan. So let me go ahead and start with a poll before we launch into some background on quality assurance. I would like to ask you about what's going on currently in your organization with regard to QA. So we have a two-part question here, which you will see in just a moment. And the first part is, do you currently have someone in your organization who is responsible for QA? And the second part is, does your organization have an actual written QA plan? So I'm going to give you just a minute, and you can say no to both, yes to one and no to the other. Or you can say, you know what, I'm actually not sure, I don't know. So let's give everyone a chance to go ahead and answer that, please. Okay, let's take a look. All right. I will share our results with you. 17% said, yes, you have a QA person, but not a formal written plan. 50% say yes to both, which is very impressive. So for many of you on the call, this is going to be more a chance to look at how to further flesh out, further improve, or enhance your existing plan. And 33% say, I don't know, which is absolutely fine because, you know, hopefully when we get done talking today, this will be a good inspiration to go back and ask whoever it is who would be appropriate and find out what's going on and hopefully be the impetus for getting a plan in place. Okay, so let's go ahead and start talking a little bit about quality assurance as it relates to the QA plan, and this will take me just a moment to get up and running again. Excuse me while I have some technical difficulties for just a moment. Okay, so introduction to QA. As I mentioned earlier, the first section of this webinar will be a very brief introduction to the field of QA, and those of you who are familiar with QA know that this is a huge field of study and practice, and we could do, I don't know how many webinars and multi-day face-to-face trainings on the topic. None of us are under any illusion that any of us, myself included, are going to walk away from this hour being experts on the topic at all. Really, this is a brief introduction that's going to focus on some basic definitions on three main components of QA using a visual model that we borrowed from another CDC program and where a QA plan fits in. So what is quality? This guy looks like he's doing a serious assessment and deciding whether whatever he's looking at is of quality or not. Quality is a word we use all the time, and I think we know it when we see it, and we certainly want quality when it comes to a car, furniture, clothes. I want to ask you, if you would, for the first time, to go in and use your chat feature to share your definition of quality. What does quality mean to you? Anyone? Okay, I don't see any responses, which is fine. I'll just share, in my mind, not related to public health, quality means that something is good, simply stated, that it's, you know, well made, that it's done well, that, oh, I see somebody thinking. Okay, I have a message that somebody's thinking. Anybody have anything to share at this point? Okay, so we're going to look at it more specifically in relation to public health, because that is, of course, oh, okay, somebody says work done well. Great, and that's exactly what we're thinking about. That's a great segue into, okay, quality to me means how well you do something. Absolutely. So I was thinking more pleased with the product or service. Great. Okay, we've got a few great definitions, and in a cohesive manner. Okay. Feel it is well made. Let me see if we have any more excellent definitions. So these are really aspects of quality, whether it comes to a service or a product. So thanks. Let's go ahead and move on then. And I think I've learned that sometimes it takes a minute for the chats to come in, so thank you for bearing with me. And we have one extra one, not extra, but a new one, providing service people are pleased with. Great. So, and of course in our realm we are providing services as opposed to, you know, making shoes or cars or furniture. So for the purposes of this webinar, we're going to use a definition from Blumenthal from a New England Journal of Medicine article where he says quality is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So what does that mean? It's a lot of words that mean, in essence, in other words, high-quality services employ best practices to help people maintain or improve their health. So that goes back to a lot of the definitions that you shared. I see work well done, measurable satisfaction. Absolutely, and that was one I missed earlier. I apologize. Measurable satisfaction, work well done, how well you do something, pleased with product or services, and in a cohesive manner, feel it is well made, and providing services. So we're, again, high quality services are echoed throughout those responses you provided. And then we'll talk about best practices. Best practices are really standards that we will be talking about quite a bit as we move through the content here. So thank you for sharing those responses. Okay, so we've got quality. Let's look at quality assurance. So what we have here is a definition from Merriam-Webster Online. And they say that quality assurance is a program for the systematic monitoring and evaluation of the various aspects of a project, service, or facility to ensure that standards of quality are being met. And you can see we have two words highlighted here, systematic, and that goes back to one of the comments we had earlier, in a cohesive manner. Certainly systematic means it's not haphazard all over the place, and that you ensure that standards of quality are being met. Systematic, it's done on a regular basis in a planned way, and when we say standards, we're talking about levels of performance or guidelines that are set either by the program itself or by an external agency, such as a funder, professional organization, or a monitoring agency. So we don't just say that we do work, we define what we mean by good work, and then we systematically check to make sure that our work meets the standards we've set for ourselves. And in a few minutes we'll talk about the plan and what the plan has to do with laying out and articulating standards for all aspects of your programs, how you are going to make sure that you do good work. So here is the model that we will be using when we talk about the quality assurance process. And this is not taken directly from, but it is based on the work of Edward Deming, who is considered by many to be the father of modern quality assurance. He defines quality as a never-ending cycle of continuous improvements. And you can see that this graphic breaks down the quality assurance cycle into three components. At the bottom we have monitoring, and then if we go clockwise following the arrows, we have quality assessment and quality improvement. And you'll note that there doesn't really appear to be a starting or end point. It's just a continuous cycle. We'll talk about each of these components in just a minute, but first I'd like to draw your attention to the oval in the center, which are those standards that I've mentioned already. They are going to become very important to us as we think about our QA plan. So let's go back to our friend Merriam-Webster Online and say, hey, what is a standard? And the answer that comes back is a standard is something established by authority, custom, or general consent as a model or example, a criterion. So a model or example, a criterion. And we use standards all the time in our lives. And sometimes they're standards for quality and sometimes they're not. Let me give you an example. If you want to buy a new pair of shoes, you may have some standards in mind. You might have a standard for color or style or material. You might say, I want leather. You might say, no, I'm a vegan. I don't want leather. I want either faux leather. I don't know what to call it other than that. or fabric. You might have a sense that you want high heels or flats or something in between. Maybe you're on your feet all day, so you have an idea about level of comfort. Maybe you're looking for shoes for a specific sport or for walking or what have you. Maybe your standard is, you know what, I really like this very trendy style, but I know that it's not probably going to last that long, so I want a cheap pair of shoes that I don't have to feel guilty about buying and wearing for just one season and then donating. So in some cases, those standards have to do with high quality, like maybe, you know, comfort might be associated with a pair of very well-made and unfortunately often expensive shoes, or it might be, you know, a criterion for color, style, what have you. So those are all standards, some related to quality, some not. But we also do kind of have standards in mind for what we expect in services, in goods, and we might not articulate them explicitly, but we will have them in mind, and I'll give you one more example from my experience. When I was in high school and college, I worked in a couple of different stores, and I won't say how long ago that was. It wasn't that long ago, but it's seeming more and more like that. And customer service was always emphasized. It was just a given that you greet customers, you're friendly, you don't hover, but you offer assistance, you're attentive, you're polite. And that just kind of got ingrained in me. I never wrote it down. I don't know that I would ever say it out loud. But more and more, at least in Washington, D.C., when I go into stores now, I recognize that in some cases the standard for customer service has really slipped when I see someone working in a store just like sitting on the counter, on the phone, talking with friends about, you know, what went on last night. And so I say, okay, you know, I have a standard for customer service in mind, and I recognize that what I'm experiencing right now is not meeting that. So in our day-to-day work, we set standards explicitly or not explicitly in several different ways. So let's turn from shoes and, you know, my experience at Radio Shack, and let's look at our work and what this means for us. Sometimes our standards are set by accrediting agencies. So for example, in the case of laboratory procedures, you have standards for storing HIV antibody test kits, running controls, reading results, confirming results. Those are all set for you by outside agencies. Sometimes your standards are set by funders. So funding agencies like Centers for Disease Control and Prevention, CDC, set some standards for you, whether you're directly or indirectly funded. One CDC developed standard that I know you're working with is that you're expected to use evidence-based interventions for HIV prevention rather than kind of pulling an idea that may sound great and may actually be great out of the air. They want you to use the Debbies and Ebbies that have been researched and tested and shown to be effective with particular populations. So let me ask you one more time to go ahead and chat in if you have some other standards that have been set for you by your funding agencies, whether you're directly funded by CDC or through a health department. Any other ideas for funder-developed standards that you're working with? Okay. I don't see any examples coming in, but I will keep an eye on my chat pane, and see if any others come in as we're talking. I'll throw out a couple of other standards that you probably are working with. One set by CDC is having a QA plan in place. And that is most likely why you're here today, although maybe it's just because you want to be doing really good work and ensuring quality. Okay. I see one here. Clients must be below 300% of poverty line to access services. So that's a great example from somebody's real-life work setting. We have services must be free to clients, state statutes, rules, and regs. Okay. Thank you very much for those examples. So sometimes they are handed to you, and how you feel about them may vary, but certainly there are things that we have to keep in mind that are either tied to funding or tied to legal and legislative situations and concerns. Other examples, in addition to having a QA plan, one I can think of with relation to interventions is that CDC asks you to keep the core elements of an intervention intact when adapting it. So you can tinker with it a little bit to make it more relevant for your target audience, but you also want to keep the pieces of the intervention that they know make it effective. And I just saw a note that says that there are some comments in the windows or the questions pane. Evaluation components must be added to program implementation and creating a pilot program to test it first. So great. These are all ideas and, standards that have come from your funders in terms of how you do your work. Okay. Also, how often to report and what goes in a report, I'm guessing, is something that you are, I don't want to say subject to, but something that you need to follow, and that's set by your funder. Okay, let's go ahead and move on and look at one more way that we develop standards, which are based on your own criteria for quality. And you shared definitions earlier about what quality is to you, and certainly I know you have your ideas in mind in terms of your programs and your services at work. When it comes to much of your day-to-day work in your organization, many of the standards in your plan will be standards that you develop and agree to, basically setting your own criteria for what it means to do good work. And this is where it gets a little tricky because organization developed standards may not be quite as black and white as some of the other standards we mentioned already. So, CDC may say we need reports quarterly and this is what you put in them. You have, when it comes to your test kits, you've got a temperature range, and we don't have that same kind of information already developed for how we interact with clients. Would be nice if you did, because that would make it a little easier, but that's probably a lot less human too. So developing your own standards is actually a great opportunity to think through and articulate how you can do high quality work in all areas of your organization. So for example, one of your organization developed standards in the area of staffing might be that all new staff will receive a thorough orientation to your organization, and that would include its programs and its policies and procedures. And in the realm of client interactions, again, it's not going to be, keep the room, the case management room between 75 and 85 degrees. It's not going to say that, but you might have a standard about the specific steps you will take when a client is considering suicide. Okay, so standards. They go right in here, which is our plan, which I know you're probably not going to write by hand in a 3-ring binder with lined paper, but you get the idea that your standards are going into the document to basically think through and articulate what those standards are and how you plan to follow them. And that really is one of the most important functions of your QA plan, is to put those in writing. And throughout this document, you're going to be answering the question, how will we know if we're doing good work? So again, some of those standards will come from outside agencies, whether they're funders like CDC or accreditation agencies like OSHA, for those of you who are doing clinical services. And some of them will come from within your own organization. I'm going to go pretty quickly through the rest of this model so that we can get to the information that we want to include in the actual plan, because I know that's probably what folks are looking for. But I do want to talk for just a minute about the other components of this this graphic or model that we're using to talk about quality assurance. We know that standards are at the center of our QA model and QA plan and that they come from different sources, but let's see what these other components are. The one you see at the bottom is quality monitoring, which is the planned, systematic, and ongoing collection of information about how your organization is doing its work. So again, you see the words planned and systematic. And here are some examples. How many people are being reached through your interventions? How long are wait times for your counseling and testing services? What is the professional experience of your new program manager? So this is ongoing, but anytime you collect information, you're really asking yourself, what is going on now at this point in time? It's kind of a snapshot. Then we come to the part where we kind of make a measurement or an assessment. Obviously, quality assessment, you make a judgment call. It involves measuring the level of quality at some point in time and then making a judgment call about how your actual performance at one specific point in time compares to the standards. So for example, how does the number of people being reached through your intervention compare with your stated objective? So at first with the monitoring you're just measuring, and now you're looking and saying, hey, wait a minute, how does this compare with my standard or my objective? How do wait times compare to the standard your program set for itself? Do you have a standard? Did you say clients will wait no more than 10 minutes? Clients will wait no more than 20 minutes. So what is the standard that you set? How does your new program manager's experience compare to the requirements laid out in the job description? So in other words, you're collecting your information in the monitoring phase, and now you're able to judge how well you're doing by comparing what you're actually doing to what you said you were going to do. And then we move on to improvement as needed. This is the third and final component. As the name suggests, quality improvement focuses on making an aspect of the program better, and of course with the intent of meeting and exceeding customer expectations and outcomes. And to go back to our example, if we learn that the number of our participants in our programs or interventions isn't as high as we said they would be, we ask ourselves, what can we do to recruit and retain additional participants? When we learn that our wait times are longer than we'd like them to be or we said they would be, we say, okay, what specific changes can we make to shorten our client wait times? And when we say, oh, our program manager's experience isn't really what we laid out in the job description, we need to ask ourselves, how can we ensure that future hires' experiences match more closely with the requirements in the job description? So again, this is a continuous cycle. There's not an end point, but an ongoing process, an iterative cycle. And certainly detailed information about quality assurance and improvement is very much beyond the scope of this webinar, but we just wanted to make sure that you have a sense of where the plan fits in. The plan is really your opportunity to set your standards so that you can go ahead and monitor and see how you're doing, assess and say, you know, how does this relate to the standard that we set, and then find opportunities for improvement. So let's go ahead and do one more poll, and I want to say I really do appreciate all of the participation, so we're going to ask you to answer one more poll. And now that we've done a short whirlwind overview of QA, let's see, which of the following would you say are potential benefits of quality assurance? And this is one of those questions where you can check all that apply. Okay, let's go ahead and see what people had to say. Okay, so all of you said that improved program delivery and greater client satisfaction were potential benefits, which is wonderful. I can tell from that response that we've got a group of very client-centered professionals on our hand. Lower program costs, some of you thought that might be useful. Certainly if you are making fewer not mistakes, but if you're not having to work as hard because things are going really smoothly, there is the potential to lower program costs. Greater intra-agency communication, 86% of you said that that was a possible potential benefit, and no one thought that the QA plan would look nice sitting idly on the shelf in your office, which is good news because that's obviously in there as a joke. But I'm sure all of you have had the experience, as I have, where you put your blood, sweat, and tears into a plan or a document, and then it ends up just collecting dust in hard copy on your shelf or taking up memory in your computer. So it is a joke, but we also want to point out that this QA plan is something that is intended to be used, and it can be a roadmap for your day-to-day work, and it relates very closely to your overall QA program as well as evaluation efforts. So let's go ahead and move on to our next slide momentarily. Okay, whoops. Okay, so we also wanted to list a couple of other benefits that we could think of. Certainly, because your QA plan is where you put into writing your organization's standards of quality, this process of developing the plan just encourages you to think through and articulate what quality means in all aspects of your work. And as we saw before, all of you had ideas about what quality meant in general, and I'm sure you have ideas about what makes for a high-quality interaction with clients, a high-quality intervention. But this is really kind of encourages you to put it out there and put it in words. It's a process that provides an opportunity for staff from different departments and job functions and areas of your organization to come together and cross-pollinate. And this actually helps, can help build buy-in among staff. Also, it's really an opportunity to impress funders. It may sound a little bit funny, but on a serious level, it provides an opportunity to report to funding agencies what you're doing, but you also can say, hey, look, we've got a really strong commitment to high-quality programs and services, and that's good for current funding, and I know how tight funding is. So it's a way to impress potential future funders as well. So there certainly is good reason to focus time and effort on QA within your agency, and the first step is developing a QA plan. So what goes into the actual plan? And this is going to be kind of the meat or tofu for the vegetarians out there of this webinar. What are the sections? What kinds of questions do you need to answer? What's included in here? So we'll discuss the 5 elements that we would encourage you to include in your QA plan. And as you can see, those are staffing, interventions, client interactions, data, and then clinical services for those of you who do provide clinical services. And I want to tell you at this point that these elements or sections and all of the information I'm going to go over in this section is going to be available on a downloadable information sheet that actually provides and there is also as well, a QA plan outline that you can use, so there's no need to take detailed notes. So let's look at our first section, which is staffing. And the staffing section of your QA plan describes how you will ensure that your staff have the appropriate knowledge, skills, and background to do their job effectively. So it's an area in which you will likely need to develop some of your own criteria to use as standards. So the way we've set this up is we have some questions that we would suggest that you answer in this section of the plan. And here they are. How will you ensure that staff members have the appropriate experience and qualifications? And that can include their work experience, their experience working with target groups that you're trying to reach out to, education, if educational level is important for the job description, and licensure, if that's something that's appropriate. How will you recruit staff? How will you provide ongoing staff training on new policies and procedures and other important topics within your organizational setting? What types of professional development opportunities are available? So that might include outside the organization. And how do you provide ongoing supervision and assessment of staff? And again, if you provide clinical services, how is clinical supervision taken care of? As I mentioned earlier, this is an area in which you'll likely need to develop your own standards, although there may be standards for qualifications such as licensure requirements or supervision requirements related to licensure for those of you who provide clinical services. So let's look at an example. Here is our case study that I mentioned earlier. We're going to look at a fictional, but again, I hope realistic, community-based organization that provides HIV antibody counseling and testing. They do case management, and they have HIV prevention interventions for multiple target audiences, and 2 of them are women of color and men who have sex with men. So that's our organization. And let's look at a case study. What you see on the right is a miniaturized version of the staffing section of their QA plan. And in this section, they address how they're going to recruit, train, supervise, and assess their staff. And what we've done is pull out just a couple of highlights to use as an examples. So in the section on staff experience and qualifications, they detail all of the information that's included in the job description for each position. So for example, they always list required professional experience, educational background, required skills, and that may include language skills if that's important to the position, and licensure if appropriate. Also, they talk about how they recruit their staff. They say that they recruit staff through a number of channels, from traditional ones such as newspapers and online listings to more non-traditional ones, including recruitment through partner organizations that reach out to multicultural or culturally specific clients, that doesn't sound right, but that reach out to specific cultural communities within their area they serve. And they also say that they make a point of recruiting former clients who may be familiar with their programs and may want to help with providing some of the services from which they've benefited. Of course, the organization would also address other topics such as training, professional development opportunities, and supervision and assessment, but we're not going to go through all of those just for the sake of time and because I don't want to put you to sleep. So I want to ask you to go ahead and chat in if you have a couple of examples of staffing standards in your agency that you can think of that you might want to include in this section. I'm giving it a minute here to see if anything magically appears. Okay, I don't see anything at this point, so I will move on. And again, I may need to circle back, but we can go ahead and, oh, somebody asked if I could repeat the question. The question was, what examples do you have from your own organization around staffing that you might want to include in your QA plan? So this, I'm going back to the case study here. They have a, they say they have a detailed job description and that they recruit staff through a variety of different channels, including looking at former clients. Ah, okay. Performance evaluation should be conducted annually. Great. So that would be an example of supervision and assessment. Any certifications required for the position? Yes. For example, licensure in social work or LMSW. So these are specific things, and you probably do these things and you observe them in your day-to-day work, but actually putting them in writing shows whoever might be reading it, including you, that it's almost like a checklist of things that you need to make sure you're taking care of, and kind of can help you keep you honest in your day-to-day work. Okay, thank you for those examples. Now, let's go ahead and move on to our next section, which is interventions. So the next section of the plan describes how your organization selects, adapts, implements, and evaluates your programs and interventions. And as we've discussed, and as you well know, CDC provides some guidance with regard to standards. So using evidence-based interventions. Earlier somebody talked about pilot testing the interventions. So here are some questions you'll want to answer in this section of your plan, and they're going to address those standards set by CDC and other standards which you may set for yourself. So how are interventions selected to ensure that they're appropriate for your target audience? This may seem very obvious, but it might be as simple as saying, you know, we look at our target audience and we look at the list of interventions and what they intend to accomplish. We know you're not going to select, just say, an intervention that was designed for adolescent African American women when you're working with adult MSM. Like, that just wouldn't make sense, but articulating how you go through the process is pretty useful and just shows funders and others that you know what you're doing and you're aware of these requirements and you actually follow the process. A little bit more meaty is how do you conduct needs assessment, pilot testing, and process and outcome evaluation? What is your process for adapting interventions? So if you find that you need to make tweaks, what do you do? And how do you ensure that you are implementing your interventions with fidelity so that you're staying true to the core elements and not, you know, kind of adapting them so much that they don't look like the original intervention at all anymore? So again, as I said, you've got some outside standards and some that you may want to develop, and let's look at our case study to see what they have to say in this area. With regard to pilot testing, they say that they pilot test all of their selected evidence-based interventions with members of the target audience, and they do that exactly as is with a small group. And they also talk about how they gather feedback verbally and in written form from the participants, and that staff members observe and they take notes on their observations using a structured observation form. So this is an example when, you know, CDC says you have to pilot, so they're doing that, but they also talk about the structured observation form that they've developed or adapted and are using, and that's their own standard right there. And then when they talk about adaptation, they say that they may make minor tweaks to the EVIs based on pilot test feedback and observations, but when they do this, they make sure to maintain the core elements. And in making these tweaks, they seek out technical assistance to their CDC project officer to ensure the integrity of the intervention. So they may end up working with Sonia or someone else at the health forum to make sure that they're staying true and having as successful an intervention as possible. Let me ask you once again to chat in some examples you might have at your own organization in the area of interventions. And again, these are things that we haven't necessarily covered, but that you would want to make sure that you highlight in your own plan with regard to interventions. Okay, we're going to go ahead, and there may be some chats coming in, but I'm going to move forward in the interest of time, and I want to really make sure that we get through the important content of this webinar. So our next section, oops, my apologies, would be client interactions. And in this section of the plan, you want to describe how you ensure quality, safety, and professionalism in your interactions with clients. And this is likely going to be an area in which you are developing, I would guess, most of the standards, but we'll talk about that again in just a minute. And here are some questions you'll want to answer in this section of the plan. How do you assess client satisfaction? What procedures are in place for emergency or urgent situations such as a client considering suicide, alcohol or substance use on site, mandatory reporting if you're working with minors? So what do you do in those cases? What is your process for obtaining informed consent for services or participation in programs? What is your process for providing referrals and linkages to other services such as HIV treatment, social and emotional support, support for intimate partner violence, alcohol and other drug treatment, or any other services or supports that your clients may need? What are your policies and procedures related to ethics of client relationships? For example, do you have explicit policies in place about social and sexual relationships between clients and staff? And as I mentioned earlier, a lot of these are going to be your own standards, for example, how you assess client satisfaction and what you do with that, but there are probably some existing governmental or legal standards for things such as informed consent and mandatory reporting. So let's go back to our organization that developed such a beautiful QA plan. In the client interaction sections of their plan, they talk about how they ensure quality, safety, and professionalism in all of their interactions. For example, in looking at client satisfaction, they say that they use a client satisfaction survey, and it's one that they got from a partner organization and they adapted to better meet their own needs, and then they also provide examples of some of the changes they've made based on those survey results. And then in terms of ethics of client and staff relationships, they note that the policy and procedures manual, which all staff are trained on, contains a policy prohibiting sexual relationships between staff and clients. I think we're going to go ahead and skip over the chatting at this point just because I want to make sure we're respecting your time, and we're going to go right into our next element of our plan, which has to do with data. In this section, you're going to describe how you handle, report, and use your data. And here are some questions you're going to want to answer. What is your confidentiality policy related to client information? How do you ensure security of hard copy and electronic files containing client information? I know I hear periodically about laptops that are stolen and they contain very sensitive client or patient information, and certainly it's in everyone's best interest to try to prevent this sort of thing from happening. What types of quality assurance checks do you do with your data entry? How often and to whom do you report data? And reporting may include reporting of de-identified HIV antibody counseling and testing data, reporting to the Department of Health, CDC, other funders, and if you use chart reviews, how do you use them? So what information do you gather, for what purpose, and how often? And these are standards that you will likely need to set for yourself, for example, how you will secure client records. And other standards, such as we talked about before, reporting to funders and what goes in that reports are, of course, set for you by your funders. So what does our fictional organization say about data? For security of records, they say all hard copy files are in a locked filing cabinet, in a locked office, so double locks, and only 3 people in the organization have keys. They also detail their process for ensuring the quality of data entry. For example, if they're entering data from a post-intervention survey, they have a 2-step process that involves doing a spot check by looking at their spreadsheet to see if there are any obvious mistakes like just empty cells, error messages, dates where there should be numbers, or they see a number 44 when the value in that cell should only be between 1 and 10. And then they check a sample of 3% of their records, or a minimum of 10, against the original source. So they pull a minimum of 10 or 3% of the paper, pen and paper surveys, and look and check it against what has been entered into the computer to make sure that they're on track. So these are some very specific examples of what an organization can do, and I bet you have some similar examples of very detailed processes you go through to ensure quality. Let's go to our last section of our plan here, which is clinical services. And organizations that provide clinical services are encouraged to address those services within your QA plan, although as we mentioned before, most of these standards are set for you by accrediting and oversight agencies. But you'll want to just kind of describe back the standards you maintain for test kit storage, guidelines for shelf life and temperature, what steps you take to maintain universal precautions during specimen collection and other clinical services, what your procedures are for confirmatory testing, and also how you store and dispose of hazardous waste, including sharps. So it takes it one step further than just simply kind of regurgitating or parroting back what you've been told you need to do. Here's the clinical services section of the plan from our case study organization. And they say, you know, here's what we know. We know that the test kits need to be stored at this temperature range. And how we ensure this is that the HIV testing manager checks and records the temperature daily on a log in the lab, and then of course they adjust the temperature as needed. They also explain that they handle all specimens and materials containing specimens as if they're capable of transmitting an infectious organism. So they say that they're aware of the standard and that they follow it. They go on also to say not only do they follow it, but that staff are trained on universal precautions when hired, and that they're observed at least 2 times within their first month of employment. So again, this is the standard and this is how they ensure it. So who develops this plan? This sounds like a lot of work, and it is, but certainly well worth it, because again it goes back to providing the highest quality services possible. So let's talk about who works on this. We would suggest a multidisciplinary team. There might be a designated person, either a program manager or whoever oversees QA activities in your organization may serve as the leader, but you certainly would want participation from program and human resources staff as well as the management and administration. And this helps with the cross-fertilization of ideas and perspective, which we talked about before, and buy-in from different areas and departments within the organization. So for example, the team could include the executive director, the human resources director, directors and program staff from the different areas such as counseling and testing, case management, and intervention. And you can certainly provide an opportunity for every staff member to review or a draft of the plan and provide feedback either in writing or face-to-face or both, as a way of getting additional perspectives and buy-in. You will also want to include an introduction in your plan. It can be as simple as a paragraph or two of text. Tells the purpose of the QA plan and the role of QA within an organization, within your organization in particular. You will want to include a work plan listing the person or persons responsible for each element and a timeline, and we'll show you that in just a minute, and you will have a template at your disposal to use or adapt for use. And it's also useful to talk about distribution, how, when, and to whom you will distribute your QA plan, and that includes people within and outside your organization. And that's another section that can be just a paragraph or two. just helps round out the document. Here's an example of a work plan. In the interest of time, I am not going to talk too much about this, but you can see that you have sections for the 5 different major elements of the plan: staffing, interventions, client interactions, and we don't have the last 2, data and clinical services on our example, but there is one on the actual template. And for each activity that helps ensure quality, you've got a place to record the actual activity, the person or persons responsible, and the time frame. Is it ongoing? Is it quarterly? Is it annually, for example? So basically, let's just wrap this up in a neat little bow very quickly and say that this plan kind of interacts with the overall QA process in that it's an opportunity to articulate and put in writing your standards, which of course you have to think through them in quite a bit of detail in order to do that, so you can measure what's going on at a point in time, assess it in relationship to your standards, and then find an opportunity for improvement. So it really is kind of the cornerstone or the basis of a QA program within an organization, very simply stated. Let me ask you now, I know this has been a lot of information in a very short period of time, but I'd love if people would just take 1 minute and share one new idea you will take away from today's webinar, both so you make the information real and people can hear from their colleagues about bright ideas that they might also be able to use. I'll tell you what, while you are thinking about that, I'll give you a minute to kind of mull over while Sonia is going over some additional resources that you will have so that you can, continue thinking about this and come back to it. Let me go ahead and hand this over to her, and if you have any bright ideas that you come up with, please feel free to go ahead and chat those in, and Sonia will share them with you. Thank you very much.
Thank you so much, Melissa, for your presentation. Whoops, we just skipped back. Sorry, guys. So just in terms of further resources, as Melissa mentioned, we do have a 3-pager, which is just sort of a simple write-up of everything that you talked about in terms of the sections to put into a plan, and that is available on our website. The link is on your screen right now. We also have a Word document that is like a template or outline that you can actually take as a Word document and then add your text and your specific quality assurance activities into that template. So that also will be available on our website. And today's webinar is actually part of a series of webinars in our evaluation capacity building series. And next month's webinar is going to be on developing an evaluation plan. So it's a little bit of a sister process, a parallel process to the quality assurance plan. And that'll be Tuesday, October 4th at 1 p.m. And information and registration is also on our website. Finally, as we mentioned at the beginning of the presentation today, the recording of today's webinar as well as the slides will be on our website, and we are available to provide more specific individual support around quality assurance among other areas through our Capacity Building Assistance Initiative. So that is me, Sonia Dublin. That's my direct email and direct phone number. Feel free to follow up with us. And also, as we said at the beginning of the webinar, we will be following up with you, and we really appreciate everybody's time and participation today. We would love to get some feedback on the webinar, as well as to give you those links to the template and the informational sheet. So if you have multiple folks who were sitting around a computer screen together today, please just chat in contact information so we can make sure to follow up and give you the links to all those resources directly. And I'm going to turn the audio portion back over to Melissa. If there are questions, we are both here still on the line. I know it's the end of the workday for those of you on the East Coast, so people probably do need to sign out. Thank you for joining us. But if you would like to stay on with us and chat in your questions or raise your hand, we can actually call on you to speak out loud, and you can ask Melissa further questions. So we will stay on the line for a few more minutes for folks to do that if you'd like.
Okay. Thank you for those of you who did share some bright ideas. I will read those that we've gotten. Someone said, I think just using the description QA appropriately and in context. So it sounds like this person is saying kind of getting some background and seeing how my understanding of this anyway is that using the plan as part of the larger QA program. Let's see. The importance of keeping the QA plan updated, and that wasn't something we talked a whole lot about, so I'm really glad that someone brought that up. Certainly it is a living document, something you want to go back to. And I see that someone said it tends not to be a living document, and as I said, and as we joked about with that second poll, I understand how that happens, and I do not have a magic formula for ensuring that that will happen, but just as a reminder and an encouragement to go ahead and really go back to that and use it as a roadmap for the day-to-day work, and perhaps doing a periodic kind of refresher on it with the excuse of it being for new staff, but to remind the veteran staff as well. And someone else said something that is finished and then unfortunately forgotten about. That seems to be a theme, certainly. Sonia, did you have any comments you wanted to make about those bright ideas?
Just in terms of folks' comments about the plans themselves not being living documents, I think I love this cycle that Melissa started with today in terms of thinking that monitoring and assessment are really only parts of the larger quality assurance cycle. So remembering that kind of ongoing cycle, and I think part of the quality improvement needs to then feed back into the reassessing or tailoring of the kind of written quality assurance plan. So we do that sort of snapshot view of what's happening right now. We think about how that compares to our standards. We make some changes to our program, and hopefully that circles us back around to kind of refining our quality assurance plan so that the next time we do our snapshot, we have a new set of standards that we're comparing it to.
Yeah, thank you. Let's see if we've got any other comments. Does anybody have maybe not a magical solution, but a suggestion or a tip for helping to make plans like this one something that people really do use in their day-to-day work? I guess maybe that's kind of a challenge that we can leave with everybody, is that when we spend so much time and thought and effort on these types of documents, that it's an ongoing quest to make sure that we do go ahead and use them, come back to them, remind ourselves how we said we were going to do our work at a very high level of quality, and then revise as necessary as we move through that three-part cycle. Okay.
If anyone would like to share final questions or comments or bright ideas, you're also welcome to click on the raise the hand icon, and we can unblock your audio, unmute your audio. Well, I guess if there are no final comments or questions, we'll go ahead and close out today's webinar. I want to thank you all again for participating. This was actually really rich in terms of the chat and how much you shared about what you're doing and the standards you're using. So I really want to thank everybody, not just for being here, but for actually participating and engaging. It makes the conversation a lot richer. And again, I really want to thank Melissa Werner for her time in developing and presenting with us today. We are really excited to have gotten a little glimpse of your expertise in quality assurance. So thank you again to everyone. Please join us for future webinars in the Evaluation Capacity Building series. And please feel free to get in touch with us for any capacity building assistance needs you have. The slides from this webinar, the recording, the document, the sort of informational sheet document, as well as the outline or template that you can actually adapt for yourselves will be available on our website. All right, thank you so much, and that concludes today's webinar.